Welcome to Her Studio. In this video, I'd like to explain to you all about safe exercise in pregnancy. This is a question I commonly get. What exercise should I and shouldn't I be doing in pregnancy? And it's something that there's a lot of confusion around. I have so many women overwhelmed because they've searched through Google and they've found 6 different answers of what they should and shouldn't be doing during pregnancy. So I want to go through and debunk a few myths and explain to you why there is so much confusion and why there's so many different answers. The first reason is because there's been massive changes in the recommended exercise guidelines for pregnant women over the last 50 years. If we think back to the 1900s, pregnant women were advised not to exercise. They were advised that pregnancy is a time for rest and that they should just sit home and allow the baby to grow. If we fast forward to 1994, the recommended guidelines said that pregnant women should not exercise for more than 15 minutes at a time and that their heart rate shouldn't go over 140 beats per minute. If we fast forward to today's guidelines, pregnant women are advised to exercise on most, if not all days of the week, accumulating at least 150 minutes total of exercise. So there's been massive changes to what the current guidelines are recommending. And part of the reason there's so much confusion is because the guidelines and the research keeps changing. The recommended guidelines now suggest that women should be active on most, if not all days of the week, accumulating that 150 minutes total. And that should be a combination of resistance training, cardiovascular activity, and also flexibility or meditation work, which is where Her Studio provides you with all of these options, integrating Pilates to get your heart rate up, barre classes to strengthen your body, and yoga to work on flexibility and relaxation, following all of the recommended guidelines. It is important to check with your midwife or obstetrician to ensure that you are safe to exercise through pregnancy. There's a few known contraindications that your midwife or obstetrician will advise you on if it does at any point become unsafe for you. And then I think it's really important to use your brain, use your common sense, and consider when it feels unsafe for you to exercise. It's always important for you to listen to your body. There are a few reasons to cease exercise during pregnancy, and I think most of these are fairly common sense. This is a guideline for pregnant and non-pregnant women if you have some sort of severely restrictive lung or heart disease. If your waters break and you go into a premature labour, probably good to stop exercising. If you start noticing heavy bleeding or bleeding vaginally, advised to stop exercise. And if you have sudden pain or heat in your calves that might indicate a deep vein thrombosis, which is a blood clot in the calf, any unexplained shortness of breath that might indicate something going on with your heart or lungs, and if you start to notice decreased fetal movement, so if something feels like it's wrong, I say to pregnant women, it's always better to be safe than sorry. Always better to chat with your midwife, your GP, your obstetrician, just to ask if you're at all concerned. So now that we know what the reasons to stop exercise are, let's talk about all the benefits of exercising. There are so many benefits of exercising during pregnancy, and the research and the evidence is just coming out with more and more benefits. First of all, it decreases risk of complication during pregnancy, such as gestational diabetes. It improves cardiovascular fitness and overall strength. It's so beneficial for mum's mental health, decreasing the risk of perinatal depression and anxiety. It's really important for fetal development with improvements in fetal growth. And there is studies coming out now that show that exercising in pregnancy reduces your risk of complications during labour and reduces the length of your labour. So let's talk about what exercise you should and shouldn't be doing. So the only recommendation I give is that we should be avoiding shortening of the rectus abdominis muscles. So this is our six-pack muscles that attach right underneath the sternum, the xiphoid process, and then down onto the pubic bone. And they're two muscles with connective tissue running up the midline called the linea alba. Now, when the belly starts to expand during pregnancy and it really starts to pop out, these muscles start to separate and the linea alba stretches. So if you are to do a shortening concentric activation of these muscles, which means something where you're lifting your head and these muscles are shortening, such as a sit-up or a crunch, the origin will pull towards the insertion. And if these muscles have already been pulled apart and you pull down, it's actually going to create widening of that linea alba, increasing stretch. I also think it's unnatural during pregnancy. The belly is trying to expand. We don't need a six-pack during pregnancy. We're trying to allow the belly to grow and expand. So why not focus on other core muscle groups? Focus on strengthening your pelvic floor, your deep transverse abdominis muscles, even your external obliques that run across like this. I'm going to show you lots of exercises that you can substitute into your classes if you're going to the gym regularly or in a Pilates or bar class. A few of my favorite exercises for pregnant women that you can substitute when they are doing lots of head lifts or lots of shortening of these abdominal muscles. Now, if we come back to the reason that there's so much misinformation out there, I discussed that there's been massive changes in the recommended guidelines. But the second reason there's so much controversy and so much mixed opinion in the literature is because it's so individual. And the advice that I would give to a first-time mum with a strong pelvic floor, with no urinary symptoms, is going to be very different from the advice that I would give to a mum who is a third-time mum. She's had multiple instrumental births. She's experiencing leakage with cough and sneeze. So as you can see, these two scenarios are very different. And therefore, my advice is always individually prescribed. I have some women ask, is it safe to keep doing CrossFit or jumping or running in the later stages of pregnancy? And the answer is, it depends. First of all, it depends what you were doing pre-pregnancy. If you were already doing CrossFit or running or jumping or any form of exercise, high impact, and you want to continue this during pregnancy, it is safe to do so. Providing that you're asymptomatic, you shouldn't be experiencing heaviness or dragging vaginally, you shouldn't be experiencing urinary leakage. So always check with your women's health physio to advise on what exercise is safe in your body. They will identify whether you're a high risk for pelvic organ prolapse, whether you have any urinary symptoms, what state your pelvic floor is in, and then advise on good intra-abdominal pressure control and advise on what's recommended for your body. What do you feel comfortable doing? What were you doing previously? What's your intra-abdominal pressure control like? What's your pelvic floor strength like? And you can see now why there's so many different answers and that it's really hard to give a blanket statement, because for one woman, I might say, let's avoid running in the third trimester because your pelvic floor is weak and we're trying to strengthen it. And the weight of the baby down on the pelvic floor is the equivalent to a 100-kilo man standing on a trampoline. So there is a lot more load on the pelvic floor. So if that woman comes into the category where there are a risk for prolapse, I'm going to say, perhaps let's alternate your program and focus on Pilates strengthening, get the pelvic floor stronger. And if for some reason running is your saving grace and it's the only thing that you can do for your mental health because you've got 2 kids at home, then I'm going to say let's weigh up the risk versus the reward. Does the risk of pelvic organ prolapse outweigh the reward, or does the reward for your mental health outweigh the small risk of prolapse? So it's always these questions that I'm considering when I'm individually telling people what exercise is safe for them during pregnancy and what my recommended guidelines would be. So the 2 other questions that I commonly get asked is it safe to lay on my back during pregnancy? And if I should lay on my side, is there a difference between the left and right side? So if we think about laying on the back during pregnancy, as you move into the second and third trimester, it is advised to avoid falling asleep on your back. They have related this to decreased fetal blood supply, decreased fetal growth, and a higher risk of stillbirth. So it is advised if you're falling asleep to try and sleep on your side. However, when you're exercising and your heart rate is increasing, the blood supply is also increasing to the fetus. The recent research suggests that it is safe to exercise for short periods laying on your back. However, longer periods are not recommended. So I suggest no more than 10 minutes of laying on your back exercising, but your heart rate will come up to increase blood supply to the fetus. If you feel uncomfortable, occasionally the superior vena cava will be compressed, and this will create symptoms like dizziness or shortness of breath. In those circumstances, it's always best to change position. Elevating the heart higher than the belly will help. So propping up onto the elbows or placing a bolster or a pillow underneath your upper back can be helpful. If you're in a reformer Pilates class, you can use a jump board and lay the jump board out so that it's over the shoulder rest. That will elevate your head and chest height. And then if you're still uncomfortable, taking an alternative exercise, either laying on your side or kneeling or sitting or standing. When it comes to side lying, the current research suggests that there is no difference from left to right side and that there is equal benefit laying left or right side for the cardiovascular system and the digestive system. So take your pick, left or right side lying, and it is safe to exercise for short periods laying flat on your back. So I hope that this has helped you understand what is and isn't safe in pregnancy and why it is hard to give a blanket statement and why there is still some controversy in the literature in regards to what is and isn't safe and why people and instructors so commonly get confused. We're going to now go through some of my favorite alternative core exercises that you can implement into your classes and some of my alternatives to yoga poses to prevent you laying on your tummy and to prevent deep twisting in pregnancy. So I'm now going to show you how you can modify exercises in classes and at the gym during pregnancy. So I've got my little balloon baby here. When we're doing core exercises, as I said, we want to avoid that shortening of the rectus abdominis muscle. So we want to avoid head lifts and crunches. I like kneeling positions and 4-point kneeling positions. So I'm going to go through a few options. This is a beautiful option because it's working the back extensors, the external obliques, and the core. So you're going to find a neutral spine. Take an inhale into the belly. As you exhale, gentle pelvic floor contraction, and then extend one arm and one leg, opposite arm to leg long. Inhale to lower down. And then you can take the opposite side. And while everyone else is doing an exercise that might not be suitable for you, this is a great alternative. The next one is in a kneeling position with the hips stacked underneath the knees. So taking the arms out long, and then inhale as you lean back, exhale as you lift up. This is nice because it actually stretches out the quad muscles while we're lengthening through the spine. So it's actually going to help with that beautiful tilt position of the pelvis, because often during pregnancy, the pelvis starts to tilt forward as the quads get tighter and the belly grows. So this is a nice position to focus on drawing the pubic bone up towards the navel without tensing the bottom. And then inhale, good breath control as you lean back, exhale, come back up. You can turn this into an oblique exercise, imagining that you're pulling a bow and arrow, leaning back, or sweeping the hand overhead, trying to tap the back of the mat and then lift back up. Option to alternate sides. The next exercise that you can do For your core strengthening, there's lots that you can do with your band. But you can come down into a seated position. And if everyone's laying down doing crunches, you can drop down onto your forearms. Press out through your shoulders, lift your chest, and then just single leg, floating the leg to tabletop. You can come onto your toes and come into bent knee fallouts with lots of control, gentle pelvic floor activation and good breath control. Option to lift up, exhale, extend. Inhale, exhale, lift, extend, in, out. So lots of options here. We can do stuff inside lying where we're getting that gentle oblique activation, pressing out through the bottom arm. Then we might stay here and focus on glutes. If you're in the early stages, you might be able to lift up, gentle activation through the side body, or coming into a side kneeling position, up on the knee, hand grounded down, and then floating the leg, a little bit of obliques and glutes, or take the hands behind the head, slightly into the side and then lift back up. So lots of exercises there that you can take into your practice to feel confident modifying and knowing modifications so that you don't just have to lay there while everyone else is doing core exercises like head lifts and sit-ups and burpees and things that perhaps aren't suitable for your body. The next thing is our yoga practice. So there is a lot of things in yoga that involve laying on the tummy. A chaturanga, which is where we lower down onto the tummy and come through a cobra, is not going to be suitable in pregnancy. Tuck my balloon in. So rather, when everyone is in their high plank, you can drop to your knees, and rather than lowering down to your chest, sit back over your heels and take a modified back bend. So interlock the fingers behind your back and lift up through your chest, or take your hands behind you, plant your fingertips, and then lift up into a camel pose. This is a really nice way to modify your yoga practice. That way you're still getting that lengthening, that back bend variation, but without coming down onto the stomach. For your twisting exercises in yoga, if they're taking a twist with the leg across the midline, often your belly will be in the way, but you can twist to the opposite direction. So you'll take your same arm to leg, and rather than twisting towards your leg, you'll twist away from your leg, creating that space for your belly. So lots of ways that we can modify our yoga and Pilates practice, and this will be threaded through the database of Her Women's Health. But I hope that these are a few exercises that you can take into your classes.